Hi, I'm Mclean, and I would love to be of service to you. During my 27 years as a qualified chiropractor and osteopath, I've been blessed to be able to help literally thousands of people say goodbye to pain. In fact, one woman was so ecstatic with the results of the treatment that she dubbed me the pain relief specialist. One of the first things you'll want to know is the treatment painful? Well, you'll be delighted to know that of the over 22 different chiropractic techniques that I know of, activator methods, which is the technique that I specialise in, is safe, gentle and effective. It certainly isn't painful. In fact, I've been using activator methods on patients as young as 6 days old and up to 92 years with tremendous results. When you come to me suffering from pain, the first thing I will do is determine the source of that pain. Often you'll be experiencing pain in one part of your body. However, the source of that pain may be coming from somewhere else. And if you want to say goodbye to pain and hello to living, then we need to treat the cause of your pain. Over the years, I've found that my training in kinesiology, body distortions and energetics has been very effective in determining the source of your pain. Let me share some of the ways I can help you. Here are 4 examples of how I have helped some of my patients. We'll talk about Jeff. Jeff's a labourer, 48 years old, and he came to me with whiplash. He'd been in an accident, motor vehicle accident, 6 months before, and he'd had persistent headaches. He was really fed up with endless pain, and that no one had been able to help him. On examining Jeff, it was apparent that the whiplash in his neck was not his only problem. The years of labouring had taken quite a toll on his spine, his knees, his body in general. In fact, he was quite a mess. Let me read to you what Jeff had to say about his experiences being treated by me. This is what he wrote. Before I was aching and paining, and now I'm not taking anything. He was referring to medication. Doing the same job and feeling 100%. Nothing else worked except coming here. I had pain on my thumbs and my knees. My back used to play up and take 2 or 3 days to settle. Now I can move my 4-foot fish tank and be all right. Infantile colic is a terrible thing. I remember 30 years ago, a friend of mine walking the streets in the early hours of the morning with his baby screaming, and doing this for weeks, and no one could help. Chiropractic treatment has a really good success rate with babies and infantile colic, especially using the activator, which is so safe and gentle. Justine is 35 years old. She's a young mum. She's a very intelligent and active woman, and she's been coming to see me for several years now, every couple of months. And she brought a baby to me, and this is what she had to say. She said, "Rod, you're amazing. After bringing my daughter Gemma to you when she was 8 weeks old, we had our first night's sleep. Gemma has had colic since she was a week old and screams and becomes very distressed of an evening. I was at my wit's end and my mum suggested I take her to see a chiropractor after she read an article about colic. Without another thought I rang you, as you've looked after my body over the years and I wish I had thought about it sooner. After bringing Gemma to you, her colic episodes started to subside and she slept for over 10 hours at night, which is like a dream come true for new parents. Then my son Luke was born. I did not hesitate and brought him and myself to see you when he was just a week old. He was actually 6 days old. Giving birth is hard work, not only for the mum, but for the bub too. And there's a lot of pressure that occurs on the body and the bubs during this time. So it was wonderful for you to realign us both, and we never had to go through the episodes that I had with my daughter. I now recommend all new mums take their babies and themselves to see you as soon as they can. My husband and I are so grateful to have such a wonderful chiropractor in our lives to look after our whole family. Thank you, Rod. At 63, Sandra was angry and frustrated with a stroke that left her disabled and emotionally scarred. Now, my approach with someone like Sandra is to get all areas of the spine, the limbs, the body, working as well as I possibly can. Because when you have an arm and a leg that doesn't move like it should, then you develop patterns of movement that have to be managed. And that's exactly what I did with Sandra. I got things to work as well as I could, and some things actually worked significantly better, and it made a big difference. And this is what she had to say. In 1998, I unfortunately suffered a massive stroke, which affected my left side and left me very disabled. My prognosis was that I might be able to walk again, but would never be able to move my left arm and shoulder. After extensive rehabilitation, I managed to walk again with a severe limp and regain movement in my arm and shoulder, albeit with a limited range. I've tried many therapies to help with my disabilities, but because I compensated a lot of movements to be mobile, I suffered considerable pain in my knee, hip and shoulder. Since being treated by Rod Mclean of Optimal Living, I've been pain-free and walking much straighter and can actually stretch my arm up high above my head, almost to the same degree as the unaffected arm. My only regret is that I wasn't recommended to Rod's service many years ago. I would recommend his service without hesitation to any person wishing to improve their quality of life. Mal's a yachty I've known for a long time. 3 years ago he came to see me with pain in his neck and in his left arm, and it was really severe. It had been keeping him awake. And my first priority with him was to relieve the pain, but I was really concerned that he had very little neck movement. In fact, he had almost no neck movement, and he didn't realise that he'd been living like this for a long time and compensating for a long time, and that he wasn't very far away from not being safe to drive. So getting more movement into his neck was a very close second in the priority stance. And there are specific exercises that need to be done to change this. It's quite difficult to do when a lot has been lost. And the patient has to be really persistent. And Malcolm's that. He did amazingly well. This is what he had to say. I decided to ask Rod if he could help me manage my debilitating neck injury that was causing quite a deal of pain and affecting my sleep. Rod indicated that my problem could be difficult to cure, but I asked him to do his best as I was resting some nights upright in a lounge chair. The injury had limited the rotational movement of my head. We were very pleased to know that I was responding after a few treatments. Rotational movement was increasing and the pain had gone. The neck is much better now, and I'm on a maintenance program and feel great. During the course of the treatment, Rod also worked on my low back that has troubled me for years. It now feels normal and has never felt better. The activator method of treatment is soothing and causes no inconvenience or pain whatsoever. I have now resumed normal activities, for instance, enjoying the sailboat and continuing on with my music, playing bagpipes in the band. Initially I was afraid I would have to give these up. I thank Rod Mclean and I'm grateful to him for what he has done. So if you are suffering from pain, I'd love to help you. Thank you for your time, and I look forward to hearing from you.